on results, and Jack Johnson just arrived in the nick of time. Hey, Jack. You look at those numbers and you have to wonder what's happening in America. Our infant mortality rate is not what it should be in America. And the tragedy is that people aren't getting a lot of the services they need, and they're getting too much of services they don't need. So we've got to get the right incentives in care. I come back to the point I said earlier about, let me just take one, cardiac care. Today, by taking a baby aspirin or taking cholesterol medicine or taking blood pressure medicine, by having it managed by a doctor, you can dramatically reduce the cost of health care and improve the quality of life. That's just one thing you can do. Though there are numerous people in America that don't have access to that advice. So they're not taking the baby aspirin that perhaps they should be taking. Or perhaps some people are taking a baby aspirin they shouldn't be taking because they just heard about it on radio or television and thought they should take one. And there's a difference between a male and a female on taking a baby aspirin. You don't know. These are things you've got to see a doctor to talk to them about. It's not an easy decision, one or the other. You've got to be monitored. Too many people in America aren't. I could say the same thing about diabetes. There's a lot of exciting things that have been developed to manage diabetes today. And so many people don't get access to that information and care. That's why the question on the qualified health centers was the right question. We need the facilities in our community. It's not just universal coverage. It's having access to care that's important to bring down costs and increase quality of care. So there's a lot of what we could do in America to make a more cost-effective system, and that's what we're trying to get right, and we need your input. Can I just pause for one moment, because I do want to thank Jack Johnson, the county exec, for all the help he's given me over the years and for his tremendous leadership here in Prince George's County on health care. And Jack, I'll give you, want to say hello?
I want to say good evening to all of you. You know, I was.
You have to use the mic. Yeah.
Let me say good evening to all of you. Had a great weekend. I was on my family reunion, just returning. So, and I did a lot of exercise. But you know, this issue of healthcare is just absolutely so critical. In Prince George's County, just to keep the hospital open, we have spent $75 million in the last 6 years, and we have $12 million in this budget. So by the end of this year, starting in actually July, we would have contributed $85 million just to keep the hospital open. That does not at all deal with the real issue of how we are, as a majority community, one of the most affluent communities in this country. But when you look at the healthcare issues of our population, it just tells you that we need reform. Colorectal cancer, one of the largest killers of our citizens, and all we need is a colorectal exam for most people. Breast cancer is rampant in our community, and we need prevention there. Lung cancer, smoking, and other diseases can be prevented. And so when we look at the major killers, all of the major killers of cancers in our community can be prevented. The whole issue is that so many of us don't have access to good doctors so that we can prevent the kinds of diseases. Obesity, a huge problem in our community. Diabetes, people with strokes in our community. We have probably one of the largest centers for dialysis across this county. It costs huge amount of money, 3 times a week. Most of the citizens cannot afford to get to the dialysis centers. We hire taxis, 500 taxis a week to carry people to dialysis. But we have to do it. We don't have a choice. and we don't get any money for it. We get some money from the state, and so we need, Senator Cardin, a comprehensive plan that will give people the kind of health care that they really, really need. There are so many other issues that's involved. Prostate cancer can be prevented. You know, I'm way past 50, and I had my physical exam the other day, and when we got through, the doctors were going through the numbers, and I said, where's my PSA numbers? He said, oh, well, you know, your test results came out well last year, and you don't need a PSA exam this year. You know, for America to tell an African-American male who is past 50 that you don't need a PSA exam is a tragedy. And the problem that we have is so many of our men are afraid to go to the doctors,
Right.
and so the doctor gives them a half test and then tell them they're healthy.
Right.
And so we need to deal with all of those issues. It's a big, big problem. I don't want to speak too long. Senator Cardin, I want to commend you and President Obama and the leadership for taking this hard task. It's not an easy task. We're never going to reach consensus on all of the answers, but the one answer that we must reach consensus on is that we need change in the healthcare industry, and we're going to get it.
Hi, my name's Nelson Lathrop. I'm from Bowie, Maryland. Although the Affordable Health Choices Act hints through some of its proposed provisions, like no lifetime annual limits, et cetera, is the act going to include specific language to address some of the hidden populations that are being left out of insurance coverage, although they have insurance? And I'm going to give you an example. Orthotics and prosthetics have been left out since probably 2000 with ridiculous limits or no coverage at all through the one leg per lifetime, one arm per lifetime, no repairs or replacements. And amputees and other people that require orthotics and prosthetics are being left out. Is there going to be specific language to address those areas to make sure that they are brought back into the fold?
One of the issues I mentioned earlier, the required benefit package is far from resolved. There's a lot of debate going on as to how the federal model will work, whether it will be specific on services or just talk about the value of the insurance product more so than trying to determine whether certain types of entities must be covered or not, such as prosthetics. So I don't know the answer to that question. It's certainly being negotiated right now. I believe the Senate bill is not clear on that, and I don't know if it was in the House bill or not, so it's still an issue being debated. There's two sides to this. One is we want to give flexibility to develop a product that will be somewhat more contemporary, so we don't micromanage too much by legislation. On the other hand, we want to make sure it does deal with preventive health care needs. Prosthetics is critically important, so I agree with you on your point.
Good evening, Senator. I'm Elizabeth Handy. I'm in private practice in Baltimore City, Maryland. And without going into long stories, I have to tell you, I have a legislative representative who works on my behalf to get Blue Cross Blue Shield to pay me. I have had to use Barbara Mikulski's office to get Blue Cross Blue Shield to obey the portability law and send me my contract in a timely fashion. They do not pay me. We have two monopolies here in the state of Maryland, United Healthcare, which I've tried to credential with for the last 2 years. They will not be adding any healthcare providers for at least the next 2 years. Blue Cross Blue Shield does allow anyone who will participate with them to participate with them. However, very few clinicians actually choose to participate with them, and I end up sending my patients often to the emergency room for medication because I cannot get my clients in to see a psychiatrist sooner than 4 to 6 months.
Your question, doctor?
My question is that, Senator, you've said that there is a lot right with our system. I'm not feeling that as a provider. And, you know, I know that there is a document, I'm sure that, our doctor knows about it, called Healthy People 2010, which strives to eliminate